Hold on then, Mel. Let's see how this works here.
So,
Okay, Novocaine. Here we are, Novocaine. Take a firm hold of the hypodermic needle. Right. There'll be a little bit of pain, and then numbness will set in. Well, I guess we'll get right to it. I'll just give you a little shock here. Yeah, I'll be right with you.
I just had to show that. I'm a general dentist. I practice just north of San Francisco. I've been using Ozone in my practice for about 10 years now. I go out into other dental offices and train other dental offices how to use Ozone. I have a separate company that I make ozonated oils, and I put the ozonated oils into products like soaps and deodorants and shampoos. We're going to also start another company where we're actually encapsulating the ozonated oils into soft gels with an exact dose so people can take those for diseases, or actually we have a doctor that's working on it with using it for weight loss. So that's going to be kind of cool. I'll go over people that are my mentors, but I've pretty much, the ozone community in the world is a rather small one. But it is worldwide, and I know most of the people worldwide, and I consider them all my mentors. So I'm going to just try and give you a brief overview today of what ozone is and how we use it in dentistry. And I know that I'm speaking to the choir, and I know that a lot of you do use ozone already. And so I want it to be really interactive, and I'm sure that you guys do things that I don't do, and I would appreciate hearing about that and hearing different ways that you guys use it in the office. And also, I'm really touched in my heart, and I really appreciate you guys having me here and allowing me to speak. It's very nice of you, and I'm really honored from the bottom of my heart. So, and I know that this part is really we're preaching to the crowd is that you guys are all different, and I want you really to embrace that in terms of how you relate to the public, because the public doesn't want traditional dentistry, and I think we all know that. And I think that this is really hard to sit here and do these slides, but they have a perception, and I think it's incumbent on us to change that perception. And I think with all these tools that we have so many tools in this room, and Ozone just adds to that menu and that list and that tool bag of tools that we can change the public's perception of who we are and how dentistry used to be. Not very many people go because of that. They don't go to the dentist, and I know you know all that, but it's just that we have to change that. We have to give them a better way, a more gentler way to come into our offices and avail themselves of our services. So I'm going to specifically, obviously, talk about Ozone, but my goal is to use Ozone on every patient every day. That's what I want. My hygienist hasn't totally bought into it. It's sort of a craw in my thing, but she offers it to them. And I just want to go in there and scream and say, no, it has to be. But some people they don't want it. And obviously, you guys get patients that turn stuff down. But I can see a use for Ozone in everything that we do in dentistry. And that's what I want it to be. I want it to be used all the time. I want it to be in our tool bag for every patient. I sort of adhere to a more minimally invasive way of doing things, and I try to do stuff that way, and I think Ozone just leads to that. We can do things that are less invasive. We can stop disease processes with it. So I think it really, really speaks to that. This is sort of a brief outline of what I wanted to go over. I know it's small type and it's hard, but I'll try to cover as much as I can. So Ozone's a molecule, so it's in nature, and I think that's one of the first questions that you hear is, so Al Gore invented the ozone layer. Well, what's different about that than what you use in your office? It's the environmental ozone that because the air has so much nitrogen in it, it's not pure like it is in our offices, because we can use pure oxygen to make pure ozone. So that's really the difference in terms of what somebody's going to ask you. It's basically taking lightning storms outside in nature. We recreate that with an ozone generator in our offices. So we're just breaking that bond with the oxygen and adding those two O1s to another O2 to make O3. It's one of the most potent disinfectants. It's 350 times stronger than bleach. And so, I mean, I know that bleach has been, our go-to, but for a long time. So this structure, and I'm not going to ask you the bond angles on stuff, but it gives you an idea of how unstable it is and how reactive it wants to be. So it wants to go out and grab stuff. So environmentally, now it grabs all the pollutants. It's really, really easy to measure ozone. It's not easy to measure carbon monoxides and nitric oxides, the pollutants that we put into the air. But it's easy to measure, and you can see how reactive it is. It wants to grab things. It wants to react with stuff. So versus bleach is what we were obviously taught to use in dental school. And so we look at it in terms of most of the time using bleach in endodontics. So we use bleach in endodontics to take out the organic material. Ozone won't take out the organic material, but it's sure going to clean that tooth. It's going to disinfect that tooth way, way better than bleach will ever do. So we have the generators that we have, and I'll show you pictures later on, but they can be as small as a brick, but we're pumping pure oxygen into a generator and coming out with ozone. So then we can apply it to wherever we want to do it. It's been around a really, really long time, and just because we haven't heard about it as much in this country as normal, we should have. It goes back to the 1700s, but officially 1840 was about the time that is official discovery, so to speak, of ozone. Schoenbein gets credit for it. 1856, they were playing with it, using it to disinfect hospital surgery rooms. So in about the 1890s, they really started to use it more in hospitals and for disinfecting things. So they were using it in World War I for the soldiers who, with the injuries that they were having, they were stopping gangrene. They were eliminating, or not eliminating, but certainly reducing a lot of the surgeries that they had to do. In this country, unfortunately, back in the 20s, there was a fellow who was not a real doctor. He got his MD from a matchbook, and nobody else wanted to be president of the ADA, or the AMA. So he elected himself, and he decreed that anything that wasn't taught in medical school was illegal. So that meant that chiropractic, acupuncture, naturopathy, everything that was outside that scope was illegal. So 1934 was when ozone became, quote unquote, illegal in this country, in the US. Fast forward, 1994, Dr. Atkins, the Atkins Diet Fellow, he was using it in his office. He was a physician in New York. He got reported to the New York board. They took his license for it. He went to court. That Superior Court decision said that we can use any treatment that we deem beneficial with the patient's consent, and it becomes legal. So that sort of opened the door in this country for alternative therapies, and including ozone. So between 1934 and 1994, it was illegal to use it in this country, and the FDA was actually coming in. They were coming in and confiscating ozone generators in your office. So, but you can see from this graphic that across the world, they were doing so much more with it. I mean, they were looking at treating AIDS. They were doing eye infections, eye diseases, cancers. They were really progressing a lot with their research. And so we really suffered here in this country. These are some of the big names in ozone in the world. On the far left is Julian Holmes. He's in South Africa, and he's done a bulk of the research in dental ozone. The fellow on the far right, Eddie Lynch, was his professor in the UK. So they worked together, and Eddie Lynch published a book, and it's a volume. So it goes over every procedure that we do in dentistry and how ozone works in that procedure. So you can just flip through it and go to ozone in orthodontics or ozone in periodontics, and you can see how it's used in that realm. Sylvia Menendez was head of the public health in Cuba for years, and she treated almost every disease known to mankind, and some that I can't even pronounce and some that I don't even know about. And she used, and how it sounds funny to us, but she used rectal ozone, so actually putting ozone gas into rectally to treat disease. Because obviously in Cuba they don't have a lot of money for fancy equipment, so this is what she had. And so she used ozonated oils, ozonated sunflower oil, and rectal insufflation to treat patients. And she had a whole protocol on how to do it, and she got resolution from just a lot of diseases. So these are people, Frank Schallenberger on the left is sort of the godfather of ozone here in this country. He has an organization, the American Academy of Ozone Therapy, and he's an MD in Carson City, Nevada, so he kind of dictates what goes on in terms of the politics of ozone in this country. Renata Viabaum in the middle, her dad was doing cancer research with ozone in the 50s. So she's sort of the queen of ozone. She's in Germany. And Phil Malka on the right, he teaches a lot of dental ozone here in the U.S., these are some of the people. It's used it has such varied uses. Most of the water supplies in the world, there's probably 8,000 municipalities. Los Angeles uses ozone to disinfect their water supplies. So it's used quite a bit outside of everything else. Globally, there's no dental ozone organizations in the world. Brazil, just this past year, passed legislation that makes it legal for dentists to use ozone, but not MDs, but they have a resolution in the legislature now in Brazil for MDs to use it. But all the organizations worldwide are medically based, although they include dentists in their organizations. So I just wanted to give you sort of a picture of how it's used in our world. So remember Legionnaire's disease 30 years ago? That could have been prevented with ozone easily. So it disinfecting fire damage, smoke damage. PCB boards are all disinfected with ozone. Papers and Every soda can is disinfected with ozone. Like all the Coke cans, everything, all the water that they use to carbonate and to flavor has ozone water in it. So it's really, really big in animal husbandry. They use it a lot. Now you can reduce the amount of antibiotics that you're giving animals. So it's huge in that respect. Medically, you can treat any disease that comes up. And this is really exciting because when I start to develop Alzheimer's, later on in life, then I know that I can just pump myself with ozone and I'm good. So, we have some pretty ugly diseases as humans. And to be able to treat a neurodegenerative disease with ozone really, really is encouraging. So, it's just exciting to see what they can do with it. I just drew a list. Pretty much you can go over and make your own list of everything, and it's just pretty much every disease that we know and every condition that we know. Because it's antibacterial, antifungal, antiviral, anti-protozoa, it kills everything. So any disease that we know of, what is it caused by, ozone's going to treat it. So it's pretty multi-purpose. The ways that we can put it into our body, the MAH stands for major autohemotherapy, which means you're just taking a little bit of blood out and you're mixing it with ozone and then you're putting the blood back in the body. So this is basically like blood doping. You're super oxygenating your blood. You can't, if you're an athlete, you can't really detect it, so it's pretty cool. 10 pass is where you actually do that procedure 10 times with pressure, so you're pushing it a little bit. So they're finding that they can resolve, during that one session of 10 times, they can actually resolve diseases. So people are getting better from their disease just in that one session. So that's pretty exciting. DIV is directly injecting ozone gas into your veins. And so you say, whoa, wait a minute, that's going to cause an embolism. So embolisms are causable with air. And so you have to remember that we're putting pure ozone in. It doesn't have any nitrogen. It doesn't have any air in it. So we're not going to cause embolisms. But there's a huge controversy on directly injecting it into your veins worldwide. There's a lot of people doing it, but they're doing it undercover. And so there was in Spain, there's an organization that created a thing called the Madrid Declaration, and it basically goes through every protocol for every type of technique that you would want to use ozone with. Well, they discourage directly injecting it into it. So it's discouraged from people. Now, it's a really, really effective treatment, and so that is a big controversy in the ozone circles. So ozonated saline injections is really, really big in Russia. So Russia and some of the Central American countries do ozonated saline. And it's a little bit technical because you think, oh, ozone's great, I can just use a lot of it. With saline, you have to just ozonate it a little bit. It's not like ozonated water where you can try and just put as much ozone into it as you can. So you have to be a little bit careful with it. And so we were talking about prostate issues the other day too. So I know I have a friend in Minneapolis who's directly injecting the ozone gas into the prostate. So you can do that. That's a technique that you can directly inject it right into that disease state. And I was talking earlier about rectal. I think rectal and vaginal insufflation is really, I think it's a treat that we have this tool because it's cheap, it's easy, and everybody worldwide can do it. It's so easy to do. They don't need to go to a practitioner. Going to a practitioner to have an IV ozone treatment is $250 to $500 per treatment. So that gets to get costly. If you have a disease and you want to go 10 times or 15 times, it starts to add up. If somebody can go home and they can take a small generator home and do rectal or vaginal insufflation, putting ozone gas into your body that way, and have the same effect as they would doing IV treatments, I think that's exciting. You put it in your ears, so people with vertigo, people with tinnitus, TMJ issues, sinus issues, it's all head related. So you can put it into the ears. And typically it lasts about 10, 15 minute treatment. They start to taste it. So it goes all through those eustachian tubes and gets into their whole system. It will cross the blood-brain barrier too, putting it into the ears that way. So drinking ozonated water and taking oils. I think everybody should be drinking ozonated water every day. But and then so Phil's got the ultraviolet or the IR saunas out there, but you can also put ozone into these saunas. The skin's obviously our biggest organ, so that can push. So they have a bunch. They have relatively small units to bigger units that will raise your children for you. So they you can push ozone into that way through the skin. And the prolotherapy. So prolozone, Frank Schallenberger developed this prolozone technique where you would mix vitamins and minerals and you would try to stimulate that area that you were injecting ozone into first before you injected the ozone. So intraorally, if you inject ozone, it's going to sting. It goes into the area, it stings for about a minute, and then it settles down. So you can inject vitamins and minerals first. Before you do that, it ameliorates that stinginess. It makes the area a little bit numb, but it's a lot more comfortable to take that ozone gas injection if you do it that way. TMJ injections, that's huge because people coming in with a joint that hurts, we go through all this rigmarole not rigmarole, we have so many techniques to treat TMJ pain. You can directly inject it with ozone and get almost instantaneous relief. Patients say that it feels like their jaw is floating after a TMJ injection. So I think that's really cool. So some of the saunas and joint injections. So you have anybody have a joint that has a problem, we'll inject it later. But directly injecting the ozone, I tore my shoulder and I put four injections and my shoulder's as good as new. My knee, same thing. So it really, really works. Plantar fasciitis, you can just inject into like the Achilles heel area and people get instantaneous relief. So they can walk fine without any pain. I just think that's so cool. So here's some of the machines. So this Helozone was a German machine, and originally this was what started coming into this country. It was illegal, obviously, before '94 to bring it in, but it was a $25,000 machine. So dentists looked at it and said, gosh, for $25,000, how am I going to recover my investment on that? It's since been, the price has gone down a bit, but the problem with this machine was that you had to create a suction around the tooth before the machine would even start. And it also ran on room air. So now you're pulling all the nitrogens in too and ozonating them. So it had no opportunity to run on pure oxygen. So that was one of the disadvantages. Longevity is up in BC. They are one of the bigger players in ozone generators. They make really good machines. Most of you probably have those if you started with that. There's a bunch of, I wanted to show you sort of a whole scope of things. And so it's not really expensive to get into ozone therapy. You don't need to buy a really expensive machine to do it. I mean, there's plenty of machines out there that are reasonably priced. Actually, this company here makes machines for longevity. So and Longevity has one of these machines. When we talk about putting ozone into the body, we have to understand what it's doing. So first, we're killing bugs, but we're also trying to stimulate healing. So ozone goes through a whole cascade of healing the body per se. So it's that initial reaction where it's killing bugs or where it's doing, but it also has downstream effects in terms of healing the body. Like I said, it's attacking it's giving oxygen to the red blood cells. So the drawbacks are that you really just can't take a jar of ozone gas and give it to somebody to take home because it's just going to disperse into oxygen. It's very, like we talked about earlier, it's really unstable, so it's just going to break down into to oxygen again. So bacteria and fungi have cell walls, so basically it's just breaking the cell wall. So it's an instantaneous kill. They don't have time to, like antibiotics. When you throw antibiotics at bacteria, they can mutate. They don't have time to mutate because they're dead. So viruses are not living, but it interrupts their replication chain. So they're not going to replicate. And protozoa, prions, they cause mad cow disease. It kills that. So It takes 168 cycles through the autoclave to kill a prion on a stainless steel instrument. So ozone will kill it immediately. So we're infecting 167 other patients. So this is just a schematic of MRSA and how ozone will come in and just break the cell wall. So my wife was working at, she's an art therapist, and she was working with a bunch of kids at a hospital setting, and she got MRSA on her midsection. So we put ozone, I wasn't home at the time, unfortunately, or I would have injected her, but she put ozone oil on it, and it kind of knocked it down a little bit, but she's pretty traditional, so she went and got her antibiotics, but it went away. She's still alive. This is just showing, like, a latex glove has that same setup as bacterial cell walls do, because they have that polysaccharide chain, so it's breaking that. So you put ozone gas up to a latex glove, it's going to pop it. It's going to make a hole in it right away. So, and that's, if you were using latex gloves, which we're probably not, but that would be one way to see that you're getting ozone coming out. So, you know, that it's doing. Compared to antibiotics, so antibiotics are specific for each species of bacteria. We're general, so it's just killing all bacteria. It doesn't matter what species they are at all. It's this column here is ozone, so it's killing everybody. These are all the other antibiotics that are killing some of them, not all of them. Talked about earlier using pure oxygen to generate it. There's 3 types of ozone generators. So there's a UV, there's a coronal discharge, and there's a cold plasma. We use coronal discharge type machines in dental practice. UV are big machines. They're used for disinfecting water supplies, so they're huge. They wouldn't fit in a dental office. Cold plasma will make different species. It'll make like O4, O7. So it's really hard to be specific and say, okay, we're going to use a cold plasma in dentistry because we're not quite sure what we want O3, but we're not sure what we're getting out. So coronal discharge is pretty stable. It gives us O3 almost all the time. So it's really similar to lightning. I mean, that's what's happening in nature. Lightning is creating ozone for us. It's breaking those bonds. And that's why you smell that crisp, clean smell when you're out in a lightning storm. Well, not that you should be. But kind of a schematic of how it's breaking that oxygen molecule and adding it to another oxygen molecule. It's really, really soluble in water versus just straight oxygen. It dissolves really, really well in water, and that's why we can use ozonated water therapeutically. So if the colder the water, the more ozone will dissolve into it. Ice water will dissolve almost twice as much ozone as room temperature water, but it's not like you can put ice water into your Cavitron and have a patient be happy. All the research was done at 4. So when we talk about ozone, we talk about concentration. We talk about how much volume we're going to put in, like 10 cc's or 20 cc's, but we also talk about the concentration of it. How concentrated is it? So all of the research that those fellows did, the people that I showed earlier, was done at 4 micrograms per milliliter. So just hang with me in terms of that. That's a really small number. Most of those machines that I showed you will generate ozone at 80 to 100 micrograms per milliliter. So we're talking about they can produce huge amounts of concentrated ozone, but the research showed that ozone's effective at a really, really small number, which is exciting because we know that if we're using a bigger number than 4, we're gonna be effective. So now just the water, like if we're taking ozone gas and putting it into water, how can we use that in the dental office? You know, we can obviously have people swish with it and spit it out before they sit down in the chair. Now you've reduced their bacterial population. We get less plume from them. So you can put it into the ultrasonics. You can use it as an endo rinse. It's going to kill bugs much more effectively. There's endo research. There's 11 papers out to show that it kills fecalis. So that's the big bug. But also, we learned the other day too that we're not just fighting fecalis and endo. We're fighting viruses and all the other schmutz that's down there. Ozone's going to attack all of it. I mean, it's just going to be a general kill. So now you can put it into oils. And the difference with oils is that vegetable oils all have a fatty acid chain. And they all have, those fatty acid chains have carbon-carbon double bonds. So what happens is the ozone comes in and actually binds to those carbons. It breaks that double bond and it binds to the carbons and forms a 5-member ring. So that stabilizes it. It's no longer ozone. It's called an ozonide, but it actually acts like ozone. So it's antimicrobial and it will heal, but now you have something that's stable. That ozone gas is not stable, but this will last, some people say that ozonated oils will last 10 or 15 years. So that's huge, and now it's portable. Now you can give it to patients to use at home. So you can use it for a whole ton of things, and I think that's what's really cool, is that if patients actually take ozonated oils home and use them, you'll see so much difference in terms of their healing process. They heal so much faster. Two things that will break ozonated oil down are water and heat. So you heat it above 145 degrees, it's going to start breaking down. It's going to break that bond. And adding water to it will actually break that bond too. So you have to do that. So now it seems really simple on the surface. You take ozone gas and you bubble it through an oil, and then now you have ozonated oil. Well, that's easy to do. We can do that in our backyard, in our garage. The problem is that when you add ozone to oil, you're going to lower the flash point. So now you have to make sure that you're not getting any heat near all that. Ask me how I know. I blew up the garage 3 times. So the last time the fire department came. But you have to figure out how to standardize them. And nobody's really done that per se in the world. You can go to eBay, you can go to Amazon, and you can buy a bunch of ozonated oil. Well, you don't know if that ozonated oil is different from this ozonated oil. So there has to be some way to start standardizing it. And there's a bunch of different ways that you can standardize the oils. And I think peroxide value is probably the most useful and probably the one that's going to be a little bit more standard than the other ones. So you can measure the time, volume, and concentration of what you're putting into that oil to make sure that each batch is standardized. You guys are so quiet. There's iodine values, there's acid values, there's a whole bunch of different ways to standardize it. POI is a value that's a little bit easier to use. So what you can do is take all those double bonds that I talked about earlier that oil has. So olive has a certain number of double bonds. Safflower oil has a different number of double bonds. You can add all those double bonds up and come up with a number and say these are the potential binding sites for ozone. And so since sunflower has more than olive, you would say that sunflower is stronger or incorporates more ozone than olive does. And that's a way that you can start to compare the oils. This is a chart showing all those different oils and how many binding sites they actually have. So you see on the top where flax and hemp seed oil have a lot of double bonds, and they can incorporate a lot of ozone. Olive, avocado are down at the bottom, so they don't incorporate as much. You can also do, if you had access to a $50,000 NMR machine, you could probably do spectroscopy on it, come up with peaks, and then be able to show that peaks were different depending on different oils. I think it's going to be. And then viscosity, too, is a way to do it. But then this starts to come to, well, my oil's thicker than your oil kind of thing, and it's not really a reliable way to sort of gauge them. So. Now you can take the oils and from a medical standpoint, now you can start to use them. And when we get people coming into our office who aren't even patients and they say, I got foot fungus, I'm a runner, I need some of the oil. It will dissolve through the nail bed, which is really cool. You can use it, people come in with vaginitis or yeast infections, and it's like it wipes it out in 2 days. So it's really great to see thankful people that it works. And so we talked about earlier about encapsulating it. Well, now you can make suppositories with the oil. You can do all these things that will get into areas where it's really, really hard to access. So with oil. I have a friend in Dubai who's a dentist and a vet. And I asked him, how does he use the oils with animals? And this was his list. And knowing him, he's really kind of an empathetic guy. So I like the one in the middle where he took a pigeon and stuck the oil on its wings. Like, who would grab a wild pigeon and try and fix their wings? So when we talk about wounds, so really in dentistry, we have to look at what we're treating as wounds. How do we look at the wounds? And we have to sort of classify them. Are we looking at a really aggressive, active perio lesion? Are we looking at something that's healing? That's a scar or has a surgery that's been 3 or 4 weeks down the road. You got that? So now we can start to say, okay, well, we have strong oils and we have medium oils, we have mild oils, and how are we going to use them? Can we use them? We can take the strong oils and start to use them on those really, really aggressive wounds. We can use the mild oils to use for something that's healing and it doesn't need so much. Velio Bocci is an Italian doctor, and he wrote a whole book on how the mechanisms, how he thinks that ozone works in the body. And what he came up with is he thinks that once that ozonated oil hits the warm skin or the warm part of the body, then it starts to break down into hydrogen peroxides and other oxygen species that stimulate healing. So that was kind of his mechanism. Nobody really quite understands how the oil works sort of in the body. This is sort of, now I'm going to sort of switch to the gas going into the body and how that gas is actually affecting the body in terms of what it does. So you can see on the top, it's got initial effects. So it's going into the blood, it's affecting the blood. But then the bottom part is more the secondary actions, where it starts to go in and start healing the rest of the body. So these are those initial effects where it's hitting the blood, and then it goes into other stuff. So, talking about dentistry, you can use it everywhere. I mean, this is just a short list, but you can see it's pretty much everything that we do in dentistry, and you can. I mean, you can find a way to use ozone in every way. I had to gratuitously put gory pictures in, but so now you have an area that's infected. You need to corral that bacterial population. So ozone, I think ozone's just a perfect way to do it. This is applying gas to that area, ozone gas, and now you're putting ozone. So an extraction, my protocol for an extraction per se would be to rinse that socket out. After the extraction, rinse that socket out with ozonated water, and then you're putting ozone gas into there, and then now you're taking ozone oil and putting it into there. So that oil is going to stay in there, and it's going to have effect longer term over those weeks in healing. One of my periodontists said that he saw. Nobody believes that. They all think I'm nuts in the county. There's 300 dentists in our county, and 2 of us use ozone. So they all think we're nuts. But one of the periodontists actually said that he saw, and I get this stuff back that looks like they used a chainsaw. I don't know what they were doing, but he saw more healing in 1 week with me using ozone on his patient than he normally does in 4 weeks. So that was just sort of verification that he likes. So frenectomies, I know we talked about that, and I was talking about treating kids, and I think we should be making much more of a big deal about breastfeeding and latching, because I think it's a huge problem that people aren't addressing. And we as dentists, I don't think we're addressing it at all, hardly. Well, we are, but not very much. I mean, there's kids that have tight frontal attachments, and it's easy to release them. It's really, really easy, especially when they're really, really young. I mean, when they're 2-3 weeks old, it's easy because you stick your finger in their mouth and they're going to cry. So they have their mouth open, and it's really, really easy to do that, to just release all those attachments. Then they can suckle better. Then they can attach better. Then they can actually breastfeed and not hurt the mom. But with something like that, you have ozone gas. You can apply it. You can use ozone oil. You can give the mom ozone oil to apply to that area, and in a week it's healed up. It looks like you never did anything. So these were taking teeth out in front, putting gas in, putting oils in, and healing 1 week. You don't get that purple look that a lot of tissue looks like after a week. So I showed those pictures of machines, but they're price-wise. I mean, you can get a machine for $500 that will work and that will do good work in dentistry, and you don't have to pay a lot of money. I mean, yeah, you can spend $15,000 if you wanted to get something, but I think you're spending $15,000 if you're going to do IV blood work. You have to. You better make sure that you have a good machine if you're going to be putting needles into somebody's body. This is just the position paper on generators in terms of what's inside. I think I already showed these pictures. I don't know why they're back, but so oxygen. You can transfer oxygen between bottles, but I won't go into that. I'm sorry, I don't know why this is doing this, but it. So restoratively, for if we're doing cavity preps, crown preps, the thing that has caused those cavities in that tooth is bacteria. And so if we can start to eliminate the bacteria, or at least reduce that population, we're not going to get as many recurring cavities. So when we put ozone gas onto, say, a cavity prep, it's going to look like this. It's going to look like, give that frosty look. It's going to look like it's etched. And it will also get hard. So you know that when we take out infected dentin, we're going to scoop out that soft stuff, but that affected dentin is still going to be a little bit soft. That will get hard once you put ozone on it. And you can sit there for a minute. And this is something you can put onto the, to the assistant schedule. I'm going to go smoke my cigar and have my brandy, and the assistant can sit there for two minutes and put the ozone on it. So it's really easy. A lot of this is assistant chair time, especially with kids. I can put the kids onto the assistant chair because they don't like me anyway because I'm the big, tall, meaty. But the assistants are great with it, and it's legal. They're not removing tissue. They're not going subgingival. They're not doing anything in the codes that's outside the scope of their practice. And a lot of it depends on how aggressive that cavity was and what it looks like. And probably I would say between 1 minute to 3 minutes I'm sitting there with it. And so if you have, so that begs the question then, Ted? So you have to remember, if you're putting that into a tooth, you have a high volume suction right there. So it's not a closed environment where you can say that I'm getting a certain concentration for that amount of time, because what you're putting in is half of it's going to be sucked out. So when we apply ozone to anything, we really have to look at what concentration we're using. So we talked about putting it into the body. We don't want to put a really concentrated amount into the body, or into a tissue for that matter, because you're going to burn the tissue. So you want to gauge what concentration you're putting it in. If there's an area that's really infected and you're injecting ozone into it, you're going to get a lot more ozone gas into that area that's infected, because there's a lot more work for that ozone to do than you would into healthy tissue. The question would be with how much concentration are you putting in there? Well, it depends. So if you're putting oxygen into an ozone machine, the more oxygen you put in, the less concentrated that ozone is going to be coming out the other side. So you have to gauge that in terms of knowing how much concentration you're coming out. The less oxygen you put in, the more concentrated the ozone is going to be coming out. So typically when you inject into the body, remember that all that research was done at 4 micrograms per milliliter. Well, that was really low. If you're injecting into the body, you're going to want to inject between 25 and 40 micrograms per milliliter. So you can see that's a bit more than 4, but we know that 4 works. So in terms of this, where we're putting it into an open area, it's a hole. But we also have the high volume there, because we know that if we put ozone gas into somebody, it's like being outside on a smoggy day. You get that irritation and that cough. So you put ozone gas into somebody's airway, they're going to start coughing. So those are there's two human tissues that don't like ozone, and it's the lungs and the eyes. So you want to kind of try to stay away from that. But if you have high volume suction right there, you could be putting 100 micrograms per milliliter because you know that you're sucking away a lot of that with the high volume. But you want to attack that with as much ozone as you can because you know that bacteria is hiding in the tubules. What did we learn yesterday? That there's 3 miles. I think there's a lot more miles of tubules in a tooth, but the bacteria is hiding in all those tubules, and we know the gas will diffuse into there. We know the gas will diffuse 2 to 4 millimeters. So between the pulp and the PDL is about 2 millimeters anyway. So if we're getting ozone down into an endotooth, we know it's going to diffuse into those tubules. And yeah, so if we're pre-treating, a lot of people were talking about preconditioning in terms of yesterday about initially doing stuff. So you can precondition stuff a lot of times, and this just shows. I mean, the bacteria is not going to attach to dentin that's had ozone put on it. And this is just an SEM of showing that there's a difference between putting ozone on a tooth and no ozone. So there's actually a physical change in the structure of the tooth. You guys don't have any questions, so I'm going to be done. Uh-huh. So he's questioning kind of what the protocol would be to do a root canal with ozone. So I like the idea because, obviously we know that root canals aren't sort of the preferred way, but if we're going to do a root canal, I like the idea of doing sort of a hybrid of bringing traditional stuff in and adding ozone to it. Obviously the gas, if you're looking at concentration, the gas is going to be about 100%, the oils are going to be about 50 to 60% as concentrated as the gas, and the water is going to be about 10%. So you kind of have to keep that in your mind in terms of how you're treating it. So, obviously cleaning it out however you would want to clean it out, but I'm going to probably use ozone water to help clean it out. And then ozone gas, once it's cleaned out, I'm going to use ozone gas because I know that's going to diffuse into the tubules and into the periapical space. Especially if I can push that gas into the periapical space, I'm doing good. And then I think there's a controversy about using ozonated oil on the files. I like it. I think it's a great idea because you're kind of doing two things at once in terms of that. Some people say, well, you're not going to be able to get a seal. Well, the whole idea of getting the seal is to keep bacteria out. Well, the ozonated oil is fighting the bacteria. But it's also, you have to remember too, it's organic. So it's going to break down over time. So it's not going to be there forever. So there's a little bit of a controversy there with the oils. Some people will go back in with Everclear, like a really strong alcohol, and try and get the oil out of the canal before they seal it. So that's kind of how I would incorporate ozone into endo. So ozone's a great desensitizer. You can take a cervical sensitivity and get rid of the sensitivity forever, which I think is pretty cool. Whitening, in-office whitening, if you're doing that and you have gel on the teeth, I would put gas into the gel. So I typically just put it in each individual tooth. So you're gonna get whiter teeth. And a couple of people walked out, and I kind of looked at them like, oh, well, they'll drink some coffee and they'll be fine. So, so this is just showing that, in terms of repopulating the bad bacteria, it's going to take a lot longer for those bad guys to come back when you've treated it with ozone. That's the thing. We were taught to amputate stuff. We were taught that amputation is the key to solving people's dental issues. And it's not. You can only drill so many holes in people's heads. You can only scrape so hard, but you're not solving things. And here's a tool that will actually it will go a long way towards resolving their disease. And that's what I think we have to remember, is we have to let them shoulder their disease. And I'm so tired of having the dentist, it's your fault, or you did that filling, or you caused my problem. No, it's their mouth, it's their disease, and they have to own it. And I think, well, it's true. This gives everybody another tool. It gives us as practitioners and them as a tool that they can accept more responsibility for their disease. And we also have a tool that can help fight their disease. So it's just, overall, it's just all the way around. Ronald was asking me too about regrowing dentin the other day. And so this is just, I don't know if you guys can see this from there. So the left picture is a big cavity, and we're putting ozone into it, and then we're putting glass ionomer in it. 3 months later is the right picture, where you can see that there's a bridge, that dentin has regrown a bridge between the pulp and the cavity. So this is what's happening. And so when we're talking about, because we were talking about pediatric teeth the other day, so I get a lot of granola moms coming in so pediatric dentists give these moms a $5,000 treatment plan under general anesthesia. There's 3 root canals, 5 stainless steel crowns, and 12 fillings. And if it wasn't so sad, you could laugh, but you have to cry. You can take that child and put ozone into their mouth and stabilize their disease, their cavities. You can stabilize that until they get their permanent teeth. And now you've won. That's the goal, is you want their permanent teeth to come in healthy. So with ozone, you can stabilize it. So they have decay on that lower first molar. They have a DO on S. And you can take out that decay. You can put ozone gas on it. But now you have a choice. Do you want to put something in there? We all know that dental materials are all toxic. So you have a choice, Mom. Do you want to put a toxic material in, or do you want to leave it open? And I think that's really wonderful. I mean, even, glass ionomers or fluoroluminosilicates, pick your poison. I know that Voco's come out with Admira. Well, you have a 2-year-old who's squirmy. You're not going to etch and bond and get a separator in there and then put your composite in. It's not going to happen. So it gives us the opportunity to offer another option, which I think is great. So this is what kills me. When I talk to traditional dentists that put sealants in, and then there's a whole controversy of fluoride bombs and having decay under sealants, it takes 3 or 4 years for that enamel crystalline structure to develop. So if you go at a 7-year-old tooth that's just been in the mouth a year, you've basically just shattered all that enamel. And so putting a resin sealant in it, you've retarded that enamel maturation forever. So now that tooth is destined to get another filling at 15, another filling at 25, a crown at 30, and root canal at 40, and an extraction and an implant. It's like, well, that's stupid. It's just a circle of death for that tooth. So why not put something on there that will kill the bugs and then will let the enamel crystals mature? It just makes so much more sense. So, so what Blanche is saying is that you ozonate the child's tooth, give the mom some iodine solution to take home to apply to that tooth to fight the bacteria that's going to be in that tooth. Perfect. Why destroy the tooth? There was a whole controversy, 5 or 10 years ago, about how we could seal in teeth and seal the decay. It wouldn't go farther, but that's stupid. So I use air abrasion. So now when you look at treating a child, you have something that, in my office, I'll show you a case later that I want to show you this case. But you have ozone, you have air abrasion, you have stuff that doesn't hurt. I mean, I haven't anesthetized a child in 6 years to do a filling. I've taken out 5 teeth in 10 years using ozone, pediatric teeth. So you can say, so the ozone with a 2-year-old's going to worry about what's going on. So the ozone, I tell them, I'm just going to blow air on your teeth. And you've been to the beach before, so we're just going to put some sand in your mouth for a bit, then we're going to rinse it out with a big car wash. So it's really, really easy to treat kids because now you have a way, with air abrasion, you can remove decay. Putting helium into air abrasion, you can cut to the pulp in 3 seconds. So you have something that mimics a dental drill, and you have ozone that's going to kill the bugs that cause the bacteria in the first place. Now you have a choice. Do you want to leave that open? Do you want to restore it? So with kids, it's really, really easy. I don't know why more people aren't treating kids. They're a joy. They're easy. And it just makes the whole experience better. They grow up and they don't tell you that the dentist tied them down to the chair and put their knee on their chest. So just looking at what a fissure looks like, it looks like a teardrop when you cut it. So you have to remember what you're dealing with in terms of that and how you're approaching it. The dentist that I took over, that I bought the practice from, he hated doing dentistry for 32 years anyway. He bragged that he was still using the 558s that he got from dental school. And it's like, wow, okay. I think so. So, I really like this. The bent pointy stick is so stupid to use. I don't know how it keeps being taught in dental school, but this Danish study showed that it was 26% effective in determining where cavities were. Okay, I mean, I can stick a sharp pokey stick into anything and, poke it out. But now you have to remember that we were talking about the enamel and crystals, right? So now you go to a 7 or 8-year-old where those enamel crystals are still developing, and you stick a sharp pointy stick in there, you've caused a cavity. Now that's a cavity. It's not bacteria motivated, but you've caused a cavity. And so this is just keeping it small.
Eric, the bitch about that is that one dentist got charges from the state board because the patient said he never used an Explorer. And so the state board said you never really did a complete examination.
So what Blanche is saying is that from a medical legal standpoint, if you don't use the sharp pointy stick, then you can be called on the carpet for not doing a thorough exam. And yeah, if you want to pretend like you're doing something, you can go around, but don't jam it in there. It just speaks to the idiocy of the state board. So if you're in Virginia, I would move. So there's 22. I'm sorry. So the question was, how are we treating interproximal, small, incipient, interproximal decay in pediatric teeth? Well, we know now that by putting ozone gas onto the occlusal surface, it transmits protection to the interproximal areas. So we can do that as a prophylactic. We can say, okay, I don't see any visible decay, or I see an incipient decay on the x-ray. I'm going to just have my assistant apply ozone gas to the biting surfaces of your teeth. And monitor it that way. You'd be able to stabilize it, and I don't think it would go any farther. Or you could actually take a tip, say, and flatten it and try and get it as interproximal as you could to apply the gas interproximally. And, obviously there's calcium and phosphorus paste and things that you could apply through there. But that's how I would deal with it. Because I know you can stabilize it. I know you can. Joan? Oh, yeah, so what Joan's pointing out is that the suction. So, like I mentioned earlier, you always, always, always have to have high volume suction going. You cannot be like, oh, hi, Mom, what did you have for dinner the other day? You have to have that high volume suction in there. And you can do it. One person can do it by themselves, have high volume in one hand and ozone gas in the other. But with kids, if with adults, you can make, I had a 10-year-old who has asthma, and we made her cough, and she's like, don't worry about it. I do that all the time. But for a 2-year-old, they don't know. They don't have any reference to the outside world. So now you've caused them to have this reflexive cough. And if you breathe ozone, it's a reflexive cough. You can't stop it. It's just, it makes you cough for about a half hour. It's really irritating. What? Yeah. But with a child, they have no reference point. So here they're coughing and they don't know why. So it's just going to be a whole to-do, and it's going to be a big drama. So make sure you have that suction there. Joan also pointed out that vitamin C is an antioxidant. Well, ozone's an oxidant. Well, we give vitamin C. It's not going to stop the cough, but it's certainly going to ameliorate it enough that they're going to be a little bit more comfortable. But then you think about, and always have either some powdered vitamin C or some chewable vitamin C in the office. But you think about it, you have this 2 or 3 or 4-year-old who's just coughing, he's crying, and mom just doesn't know what to do. You know, the fact that you're going to try and get him to chew something is not going to, it's going to be difficult. But the most important point in that drama is to reassure mom that it's going to be okay. You did kill her child. It's going to be okay. A half hour, the child's going to be fine. And that's really the major point to get across. So there's about 22 studies that show that ozone does not affect bond strength. It doesn't increase it, it doesn't decrease it. So there's one, the Cochrane study, boy oh boy. They did a review paper, and they tried to show that it decreased bond strength, but people shot them down, and it's just that paper wasn't worth it. So. So the question was, if you're not going to seal that tooth, how often would you bring that child back? I think you have to look at their caries risk. And if they're a high caries risk, I'd be doing it almost every month, but I would say realistically, probably every 3 months. So I think that's a reasonable expectation. And that's something that can be put on the assistance schedule, and I would monitor that. Remember, with kids, we're just stabilizing the teeth. I don't care how bombed out those teeth look, you can stabilize them. And you can put composite or GI and make them look pretty, but all you're trying to do is stabilize them and not let them get infected, not let them get abscesses. And that's easy to do. Easy. So I have 10 minutes? Okay, I'll fly through this. So that went fast. I was having too much fun. I think where it really shines is pediatrics and perio, because you see the most difference. You see huge differences in both of those. If you give patients ozonated oil to take home after you've done periotherapy, you're going to notice so much more healing than you normally would. And so if you have ozonated water in all your ultrasonics, you're going to lower that plume. You're going to lower your exposure to all their oral bacteria. So this is just pictures of, ultrasonics and the gas. So you're putting a tip on that. So this handpiece is coming directly off the machine. So it's a little different. So if you have a big machine in the hallway, you're going to take a big syringe off, and you're going to push that gas in from a syringe. If you have a smaller machine in every room, you can put a tube from that machine and directly have the flow into that tube. You're going to have a really small tip that can go underneath the tissue, and you're going to apply it to all the sulci. And so here's the high volume. You have that high volume there. This was a case. So this woman came in 4 times between October and April. And so you can see where there's that bone defect between 19 and 20. That's how much it grew back. I realize it hasn't grown back 100%, but that's how much bone regrowth we got. This woman was non-compliant. She did nothing at home. I'm surprised she even brushed her teeth. But so that was just 4 applications over that period of time. You guys learned, this is preaching to the choir. Here's some gross pictures. Diabetes link. Oh. Oh, so you do this. So I think we should be, there's so many pre-diabetics and so many people with diabetes for that matter. This is I looked it up, and this is without a finger stick. So we could be testing in office without finger sticks. So It's a company called Freestyle Libra Flash. It's by Abbott, and it's just a monitoring system. And it's a little patch. You put a patch on, and then you have the meter goes on the patch, and then they can then you can look at your A1Cs and your blood glucose. Biofilm. You guys learned all about biofilm yesterday. That's the thing. We have to remember that bacteria is really smart. We don't give them credit for being so smart. We think bacteria is dumb. We think we can just throw something at it and kill it. No. I had a patient come in with an abscess over 8. So I injected it with ozone gas. The next time he came in, it was over 11. They just picked up and moved their whole village. They said, okay, you're going to carpet bomb us. We'll just move. And the next time that he came in, it was over 7. So they just move where they want. And they know what's coming. And when patients like, oh, brush and floss, oh yeah, okay, the broom and the little rope is going to come and we're just going to like run away. They don't care. Oh, so this is a schematic. I'm going to test you guys on this later. So this is a schematic of what happens when tissue breaks down, when gums start to break down and you get a pocket. So when we can notice it, it's down at the bottom. These are all the things that go on before we see it. He used to look like Robert Redford before he had surgery to do that to his eyes. Just creating healthier biofilms. That's really the key, is just to say, you got bacterial poop in your mouth. It's fossilized now because you let it go so long. So let's create a healthier environment for that biofilm to grow. This was fecalis on an agar plate so ozone was on the right. And this is the beef with endo, is that you can show this to an endodont. Well, they wouldn't listen anyway. But so you can section a tooth. I mean, this is how much bacteria is in an endo tooth, and traditionally we're not addressing it at all. We're just letting that bacteria go. I think this guy was a second retreat, and he was like, I don't want to retreat it again, and I just started injecting ozone. So they say you can't grow furca bone back. Well, yeah, you can. There's a ton of endo research out there. There's a ton that shows that ozone's better than. And we talked about chlorhexidine yesterday. It's like what's allowed in the U.S. is 0.012%. Well, they did all the research with 2% in Europe. Well, yeah, 2% kills. It tastes like crap, but it kills bugs. Well, at 0.012%, it doesn't do anything except for stain teeth. And I don't understand implants. It's heresy. This was a study. It was really sad. They took New Zealand bunny rabbits and then they put implants in them and then they killed them. So the implants that had the oil on them integrated much better at 5 weeks than the ones without oil. So I always dip my fixtures in oil before I place them. You can heal peri-implantitis, so you get the specialist saying that it's our fault that implants are failing. You can heal that. Dentures. So now you have something where you can put the oil into dentures, or you can even have them take aligner trays and put the oil in that and wear that for somebody with high caries, dry mouth. But now you have something. Lichen planus. We wrote a paper on lichen planus. This is so hard. This is tough because it can be whole mouth, or it can just be certain areas, and it basically turns the gums like fire engine red, and it just hurts a lot. So it's not easy, but you can treat it with ozone and you can get resolution with it. So, no, I just inject the crap out of it. So, yeah.
But you're going to get the big reaction.
Liz is saying that she's worried about putting too much ozone into lichen planus, and you have to look at what you're treating in terms of that and how advanced it is. I think you can put a lot of ozone into it and get away with it. My wife is really bad. She's just like, oh, this tooth's starting to hurt me, and then I go in there and it's just like a huge carpet bomb mess. But so 14, that was bothering her. So I took her down to the office, and I went in there and it was like no buckle bone. I'm like, holy crap. And so I started injecting ozone, and then pretty soon she had this like grapefruit size swelling on the side of her face, because I probably put like 20 cc's of ozone in there. And so I was like, I'm going to get rid of that stuff. And then it started going down her face. And the only thing going through my mind is, holy crap, this is an ER visit, and they're going to say, what the fuck were you doing? And so, like, thankfully, we were going over to San Francisco to my friends to do IV ozone that day anyway. And I said, and she doesn't believe in ozone, so she just thinks I'm nuts. But so I said, you are going with me. And so a half hour into the IV treatment, this was all back to normal. And I was like, she didn't know the difference anyway, so it didn't matter. But people come into the office and they're like, I don't have any tooth problems. I just got this canker sore right here. Can you fix it? Just gas and oils with canker sores, 3 days they'll be gone. And there's no Valtrex or anything like that. You don't have to worry about it. Ortho. Ronald was talking about ortho. I think that everybody in brackets should be coming in once a month to do ozone treatments. There's studies to show that the ozone will reduce or eliminate white spot lesions. So, Mom, if you want to have an ugly kid, then you can not have ozone. And they should pay for it. They should pay for it. If they come into your office to do ozone therapy, they should be paying for it. And we charge, I think, $125 to come in and do shots. So you can charge what you want. Here's all ortho research. Anesthetic reversal. So we did anesthesia on the canines, and we put Oraverse on one and ozone on the other, and they basically reversed about the same time. So you have a cheaper anesthetic reversal. Custom trays. I mean, you could rig up a bunch of stuff and put gas and everything. And I think a better way would be to just make a liner trays, put some oil in it, and have them do that at home. I think that makes so much more sense. Teeth whitening. This goes to your teeth whitening. This theory, this paper was postulating that the bacteria are chromophobic and that they have different colors, and they express in different colors on this staining. The ozone took away the coloring. These are just pictures of so this, I just want to show this real quick. So I don't know if you guys can see the lesions, the interproximal lesions on E and F, and then G is fractured. So she went to a pediatric dentist. She lives about 2 hours north of where we are. She went to a pediatric dentist, 2 visits with anesthesia. Luckily, it was just local and not GA. She did two endos on E and F. She did 2 stainless steel crowns on E and F. She extracted G. And so when the child got to us, she wouldn't open her mouth for me. But anyway, in our office, this would be air abrasion, it would be ozone, and probably a little composite. It would be a 20-minute appointment, and they would be done. So that's the difference. You like that? Yeah, that was it. Try writing that. This goes. Okay, so this was where you have that option. You have that deep cavity. Well, yeah, you can put GI in there, or you could leave it open. You know, you have that choice now. I just think it's General O'Connor. I talked about GA. This goes back to what Joe was talking about. It's vitamin C, gas injections. So basically, if I'm just somebody's coming in and saying, just inject me with ozone, I'm going up behind the second molars, just like a block that I would do right in the bicuspid area on the top. So I'm doing these 4 spots. I'm going in where the hemiorrhoid notch comes down, and I'm doing these 4 spots. So basically just dropping a half cc to 1 cc in all those areas. But I'm doing prolozone first, so that sort of ameliorates that stinginess to it. But that would so you're getting the head of the nerve chains, and it's transmitting all the way down along those nerve paths. This is just showing that. 2 sensitivity, we talked about that. That sensitivity goes away forever. In that spot, it won't come back. And then this, I think if the public knew how dirty our water lines were, they would be totally grossed out. I mean, we're allowed 500 CFUs in our lines. That's a lot. That's 500 million bacteria. That's really gross. So, and take your hand pieces off the first time you do ozone through the lines, because you're just going to get just sludge. It's like the Ghostbusters movie where they got slimed. That's what it looks like coming out. So, just review. Safety-wise, in Germany, they did a study with all these millions of things. The side effects or the detrimental were the coughing. That's all it is. So, and we talked about how dangerous prescription drugs. So OSHA, there's OSHA regulations. We are like 1/100,000th of what OSHA regulation is in terms of how much ozone we're using in the office. This study, this was, I think it was cruel, but they had class 5 fillings, cavities, they put ozone on it, and they said come back in 2 years. 86% of those cavities didn't get worse with ozone. So, and that was at 4 micrograms per milliliter. You can find hearing loss. You can treat that. And we were talking about osteonecrosis too. I think it's wonderful in treating osteonecrosis. It's the only thing that really works. We talked about spirochetes. It's the only thing that will kill spirochetes. So if you have somebody that's got raging perio, you know they have spirochetes. Anyway, that's it.